Hey guys, it's Dr. Barron. Come get ready with us as we prepare for Chantel's surgery. The big day is here. Here I am in the pre-op area just discussing what to expect after surgery, going over the surgical plan. Typically I'll go over what size the patient wants to be, where the incisions are, what the dressings will look like, and kind of what to just expect in the post-op period. So once all of that is out of the way, then I will start marking. I will put on my surgical marks, which mainly they are for symmetry, to make sure that everything remains as symmetric as possible and even. As you see, Chantel has very large breasts. I know some of y'all, I guess, were speculating that she had implants. There is not an implant anywhere near her body. This is all of her natural breast tissue that we are going to reduce. So I'll place some markings on the breast where the new nipple position is going to be, and where I'm going to cut out some of the extra breast tissue and also the skin. The main goals of a breast reduction are to move the nipple areola complex, maintain the blood supply to the nipple areola complex, reduce the breast tissue, and then also redrape the skin envelope so that things are nice and perky. The markings are typically placed while the patient is in the standing position due to gravity and making sure that everything will be as symmetric as possible. Breast reduction patients are typically the happiest in most plastic surgery practices. They often say that they wish that they would have done it sooner and not have put it off. But they're happy because they instantly have a load taken out of their chest. They've been uncomfortable in bras, uncomfortable in t-shirts. Sometimes it can affect body image, along with the discomfort that they have from just having heavy breasts. Chantel has very dense breasts. And as you can see, she has a very small frame. So these breasts are literally just hanging off of her body and pulling on her, in regards to her posture and her overall shape. So she's going to look and feel amazing. She's going to be able to find regular bras that cost regular prices, and her body image overall is just going to be improved. So here she is in the operating room. She's super excited. Our staff is getting her all settled, making sure that she's appropriately padded on the operating room table, just because this is performed under a general anesthetic, which means she'll be asleep throughout the procedure and the breathing machine will be breathing for her. So we just got to make sure that she's secured on the operating room table. We put the leg squeezers on to make sure that she doesn't develop any blood clots during surgery. And this is the anesthesia machine, which will help breathe for her during surgery, along with other monitors.
Anyway, it's finally happening. I'm so excited, but I'm ready. And I know that I'm going to love my new boobs.
So it's important that the patient's adequately oxygenated before the intubation process. So the anesthesiologist is giving some medications and our anesthesia assistant is helping ventilate the patient. And then they'll put the breathing tube as she drifts off to sleep. All right, getting scrubbed for Chantel's surgery. So now it's time to scrub. It's time to get these hands nice and clean in preparation for surgery. And then once I'm scrubbed, the surgical tech will help to gown and glove me. Our circulator will help to tie me up and then also assist with getting certain things during surgery. But it's time to get started. How much do you think that I'm going to take off from each breast? Let me know your guesses.